Everyone. My name is Jessica Peterson, and I'm an outpatient mental health and substance abuse therapist for the Harbor Beach Community Hospital. And tonight I want to share some information about women in mental health. And for the record, I'm not saying that mental health is more important for any gender, but it is known that mental health disorders can affect women and men differently. And, like, for example, some disorders are more common in women, like depression and anxiety. So there's actually a lot of research being done as of to why is there some misdiagnosing going on, but that's besides the fact that right now depression and anxiety are more common in women. So, because tonight's Ladies' Night, I'm going to talk about women in mental health, but I'm also going to talk a lot about coping skills that are very universal and can be used generally anyone across the board. So, did you know that there are certain types of mental health disorders that are very unique to women? So, some symptoms of mental health disorders that can appear at times of hormone changes, such as perinatal depression, which is also known as postpartum depression. There's also premenstrual dysphoric disorder and perimenopausal related depression. So, I'm going to talk about some warning signs related to mental health disorders. And these are not just specific to women, but can also be universal. And if you're experiencing or a loved one is experiencing any of these symptoms, please talk with your loved one or reach out for help. Reach out for that support and help. And I will talk about getting help in just a little bit, okay? So, some warning signs of mental health disorders can be persistent sadness or feelings of hopelessness, misusing alcohol and or drugs, dramatic changes in eating or sleeping habits, appetite or weight changes, decreased energy or fatigue, excessive fear or worry, seeing or hearing things that aren't there, extremely high and low moods, aches, headaches, or digestive problems that don't have a clear cause, irritability, social withdrawal, and suicidal thoughts. So, I'm going to talk about coping mechanisms, which coping mechanisms is just a fancy word for techniques that we use to reduce the impact of mental health symptoms or reduce the impact of stress. I'm going to share some that I use personally that I keep in my toolbox of coping skills that I use to keep stress at bay, mental health symptoms at bay, so please feel free to add any of these to your daily routine. But also, again, don't be afraid to ask for help from a trusted professional if adding these to your daily routine is not enough. So if these self-help suggestions just aren't enough, please talk to someone. So I'm going to add my disclaimer that I add to all my videos, and that is talking to a trusted professional. So, a trusted professional can include anyone in the helping profession. This could be your doctor, a therapist, a psychiatrist, a counselor, anyone in in the helping profession, a good support system for you. But please talk to them. I include my number in the comment section, and this number is to my office. But you are more than welcome to reach out if you have a question about mental health, if you want help, if you want to be pointed in the direction of help. Please call this number, and my mental health team will get back and help you. But if you are having any thoughts that we would consider an emergency, so if you're having thoughts of harming yourself, killing yourself, or harming or killing anyone else, please call 911 or go to your nearest emergency room so that you can get the immediate help that you need. So these self-help techniques, these what we call these coping mechanisms, again, we use these to manage stress, reduce the impact of mental health symptoms. And yes, tonight is we're talking about women, but I want to add techniques that can be universal so that we can reach out to as many people as we can. Maybe you're a woman, but maybe you have a loved one. Maybe a significant other is going through some of these warning signs I talked about before, or maybe it's you, but please utilize some of these self-help techniques. I'm going to start out with the basic ones because these are the ones that we hear about from our doctor. These are the ones we hear about all the time, and we may not include them because we don't think they're as important because we hear it all the time. But some of the basic self-help techniques are going to be your exercise, getting your body moving. So no matter what that is, it can look like cardio, it can be yoga, it can be stretches, whatever is appropriate for you and whatever your doctor allows. But get up and move. That might even be just a short dance break. Just get up and get moving, eating balanced meals, getting enough sleep, and staying hydrated. And if you have any questions about what staying hydrated means for you, what getting enough sleep means for you, what eating balanced meals mean for you, and what exercise should look like for you, talk to your doctor, do your well health checkups, and talk about these things. Adding these self-help techniques to make yourself healthier, not only physically, but I include these because they help your mind. So those were some of the basic ones that we talk about a lot. The next one I want to talk about is deep breathing techniques. So I know that some people find this kind of silly because people think, we already know how to breathe. Why are we doing this deep breathing? But when we're really stressed, when we're panicking, if we can practice alerting our brain to take some deep breaths, it helps slow our heart rate down. And when we slow our heart rate down, it's telling our body, okay, it's time to relax. Okay, it's not fight or flight. We don't have to fight anything. We can relax. So if you search on YouTube, there are endless options for a number of different ways to do breathing techniques, which I know also seems kind of silly because how many different ways can there be to breathe? But trust me, just do it. There's tons of different ways. And in the resource comment section, I included a handout from the University of Michigan about deep breathing techniques, which included a couple different ones. So today I'm going to talk about box breathing. So box breathing is one of my favorite ones to use. And I'm going to go over the directions, but if I go too fast and you want to learn more about it, again, in the resource section is going to be an instruction manual for the box breathing. But the first step you're going to do is you're going to slowly exhale all that breath out of your lungs to a count of 4. So I'll try to do it alongside while I'm trying to count and things. So you exhale to a count of 4, and then you slowly inhale to a count of 4, and then you hold your breath for a count of 4, and then exhale again for a count of 4. Now, if a count of 4 is a little bit too much for just your lung capacity, just start off with 3. It doesn't have to be 4. This is just the whole, box type breathing. And then you can hold your breath again for that count of 4 and start again. So if you remember what a box, the 4 sides of a box, that is the whole point of the breathing exercise. And you can even trace it when you're trying to do the breathing. Anything to keep you on track. What this is going to do is help you with your heart rate. So we talked about the basics so far. We talked about deep breathing. Another technique that I really like to use when I'm really feeling like my head is spinning, I need to ground myself physically to the ground, is a grounding technique I call the 5 senses. 5 senses. So you can do these in any order, but let's say my head is spinning and I need to ground myself. Again, this is going to take practice just like everything else. My head is spinning, and I am going to name 5 things around me that I can see. And if you can do this out loud or in your head, but really describe these items. So I'm in my home office. Actually, just using the camera, I can see I have a plant back there, so I'm going to say it's pretty green, it's pretty long, it's actually doing pretty good. I see my laptop in front of me, black, silver, but really, really describe these items. And so you're going to do 5. And then you're going to do 4 things you hear around you. Right now, I think I hear my dogs walking around. There's some rain on the window. Really describe these things. So we have 5 things you see, 4 things you hear, 3 things you can touch. So I have my phone here. I can feel the green on the desk. And really just get in there more than I am doing right now for time's sake. Really get in there. 2 things you can smell, and 1 thing you can taste, whatever that may be, 1 thing you can taste. So go through those 5 senses. And what this is going to do is when you're in a situation where your head is spinning and you're going everywhere, this is really going to remind you, like, this is physically where I am right now. And as you're thinking about these essentially silly things, like I was talking about my plant, as you're talking about these silly things, your mind is slowly drifting away from whatever was that big stressor right there for you. So you can do this in the car. You can do this pretty much anywhere. You can do it in your head. So you can be, in a meeting and really be stressed out about something somebody's saying and quick pull up those five senses. That's a very good grounding technique. So we talked about deep breathing, grounding. The next tip is just a little bit of a general tip, but de-stressing with activities that you enjoy. So some people de-stress with adult coloring books. Some people de-stress with like crossword or word searches. It can be reading, anything that tells your body it's time for us to relax. And this is a really good tip to use, especially, let's say you have a hard time sleeping. Doing what some of these de-stressing, relaxing activities will help signal your body and say it's time for us to relax now. And like this could be even drinking a warm cup of tea, or my personal favorite right now, hot chocolate at night. It just helps your body get to that point of relaxation. So grounding, deep breathing, de-stressing. The next one, gratitude. So I know a lot of people also kind of roll their eyes at this one, like I'm thinking negatively, what the heck do I have to be grateful for? But if we practice and maintain a practice of gratitude, we're essentially changing our perspective, our mind's perspective on things over time. Just like any of these skills, if we practice it, we're rewiring our brain. So gratitude and mindfulness really go well hand in hand. So being grateful for the little things that we may not notice in our life. So kind of going through your day, and maybe be that little things. Let's say you're brushing your teeth in the morning, being grateful that there's running water, being grateful that there's a toothpaste that you enjoy, or may not enjoy. I don't know. But being grateful the sun's out in the morning, being grateful um, for just these little things that we often kind of just take for granted as part of our day. And while doing this and being grateful for those types of things, we're really helping rewire our brain. And so this kind of rolls into the next tip, which is mental reframing. That's basically what we are doing when we are looking at the other aspect or the positive aspect of a situation. So mental reframing is taking an emotion or a stressor and thinking of it the opposite way. So I'll use an example. While my life is very horrible right now, I'm going to be late because of the traffic. Why does this always happen to me? We may be in similar situations. Maybe it's not the traffic, but we maybe have all asked ourselves at one point, why do this always happen to me? So, with mental reframing, another way we can look at wow, my life is so horrible, I'm going to be late because of the traffic. Why does this always happen to me? Another way we can look at it is this traffic is very bad, but I still get to where I'm going. I'll still get to where I'm going. There's nothing I can do about it right now, so maybe I can listen to my favorite music. Simple, just different perspective of the same situation. Nothing changed about your situation, just the way you looked at it changed. This technique can be really hard because we're um, kind of programmed to think of things negatively. Way back in the day, that's how we survived in like caveman days. That's how we outran the saber-toothed tiger. That's how we survived, is by thinking negatively about a situation. We don't really need that so much anymore. And so this technique is going to take a lot of practice, but it can help change your perspective over time. And you'll start noticing that in tough situations, the negative part isn't always the first part you think about. And it's going to be such a great feeling. So we talked about mental reframing. We talked about gratitude and using mindfulness throughout your day to pay attention to things you may not have noticed before. Like take that time. I'm talking like the weather, take the time of a stranger smiling at you. Well, hopefully they're wearing a mask, but before strangers smiling at you, anything that you may not notice in your regular day-to-day activities. We talked about de-stressing with activities that are very relaxing and calming, grounding with your five senses, doing your box breathing, your deep breathing, And then we talked about the basics, so getting enough exercise, eating balanced meals, getting enough sleep, and staying hydrated. So I hope some you can take some of these self-help techniques and utilize them, but I also hope you can take the message that um, don't be afraid to ask for help. If when I read off those warning signs, if you thought, yes, that, I've been experiencing that, or someone I love has been experiencing that, of course, if it's someone you love, talk to them about that first, but reach out for help. I included my phone number here in the resource section, but that's not all there is available. At your next doctor's visit, make a visit with your doctor. Talk to them about that. They can help you direct you to the help too, um, or whoever may be available for you, your support system. Talk about that you are not alone. And I hope you have a great night. And thank you for listening to this video all the way through. Bye.